Hello, everyone. My name is Callie Frost. I am part of the clinical team at Nordic Laboratories, and the presentation today is really just intended to highlight the differences and the changes that have come with the new Dutch test. From May 21st, there's been an upgrade in the formatting of the report with the addition of a few new extra markers and updates to the report. So today I'm just going to run you through those, and hopefully it makes more sense when you receive one of the newer updated reports. So what has changed? There is a major visual upgrade to the reports. I will show you in the next few slides. Age-dependent ranges are now integrated into the androgen dials. The addition of 5-alpha androstenediol on the summary page, which is a very important marker of tissue androgens and marker of intracellular DHT metabolism. There's expanded reporting of androgen biomarkers on the female sex hormone page. The cortisol clearance rate slider is now included, which is a marker of glucocorticoid metabolism. And there are now changes to the clinical support overview. So a lot more precise and clearer recommendations at the clinical support at the end of the report. Okay, so looking at the report, this is what the report looks like on the left-hand side. So you'll see from a visual point of view, it appears a lot more cleaner and neater and easier on the eyes. So this is the female sample report. So you'll see on the summary page, there is the addition of 5-alpha androstenediol, which previously was not in the older version of the report. There is under the cortisol section, so the adrenal hormones, you'll see there's a cortisol clearance rate. So that is looking at glucocorticoid metabolism and the rate of clearance, whether you are a fast or slow, the clearance rate in that regard. And I will obviously elaborate on those markers in the next few slides. So those are the sort of major differences. You'll see the age-dependent ranges as well previously were in the table under, if you see under adrenal hormones, for example, the total DHEA production, there's the age and the ranges. That is now excluded and integrated into the dials with color coding. Again, looking at the female sample reports, if we actually look at estrogen metabolism, you'll see some of the changes that I've mentioned. So the expanded sort of explanation on the androgens, the testosterone 5-alpha and 5-beta DHT, and 5-alpha androstenediol and 5-beta androstenediol are now included in the female sample report. The male report always had this section, but the female report did not have this included in the actual estrogen metabolism page, as shown over here. What is also very nice is that we are able to see it clearly highlights phase 1 and phase 2 estrogen metabolism, which previously was also not indicated in the older version of the reports. So that is a bit easier to understand. The methylation activity is still there as per usual, and you can see the color coding with the dials, which I will explain a little bit later. Okay, looking at the male report again, pretty similar to the female report in that 5-alpha is now included in the summary page. The age-dependent ranges on the right-hand side of the old report are now just integrated into the dials. And then that cortisol clearance rate is now included in the new report. And then you'll see at the bottom of the newer report, they have got the color coding for the ranges for the different age groups. Okay. Looking at the estrogen metabolism or hormone metabolism pathway on one of the pages, the page 3 of the report, again, just highlighting in the older report, we had those age-dependent ranges on the right-hand side. That is now integrated into a color coding table format, which is integrated into the dials. You'll see on this summary as well that the testosterone androgen metabolism pathway, as I mentioned earlier, is still the same as it was in the older report. That was always included in the male report. It just was not included in the female report. Okay, so as I said, the androgen dials throughout the report really just feature the color-coded age-dependent ranges with color-coded arrows that point to the points in the ranges that the patient's results falls. Previously, we communicated age-dependent ranges via a table near the dials, and that just really required finding the patient's age range and mentally applying it to the patient's range for each androgen. So now, just with the little orientation, the dial can be read out and understood quickly without having to reference other resources. So in men, the most significant changes in testosterone happen around the age of 40. Therefore, there are two age ranges which cover 18 to 40, which is light green, and then 41 above, which is dark green. And then in women, premenopause is indicated by a light green, which is ages 18 to 40, and then postmenopause, which is purple, which is women over the ages of 56. Okay, then the addition of 5-alpha androstenediol on the summary page. So that marker was always included in the old report in the table as indicated on the right-hand side, except it was not included on the summary page on page 1. So 5-alpha androstenediol is very unique in that it is thought to be the best marker available of DHT formation and activity inside the cell. And really just numerous studies are now supporting the value of 5-alpha androstenediol as a marker of androgen status in women. And that prompted an update to the Dutch reports, where providers can now find 5-alpha androstenediol conveniently showcased on the summary page. So that was really just the major reason for including it on that summary page on page 1. Okay, then looking at the cortisol clearance. So this cortisol clearance rate is a new addition to the report. We used to be able to eyeball it based off the patterns of the saliva cortisol and the metabolized cortisol patterns. Now, having the clearance rate slider bar, it just makes it a whole lot easier for us to understand the rate of cortisol clearance without having to, as I've said, eyeball it and understand the pattern. So the cortisol clearance rate is calculated by dividing the total metabolites of cortisol and cortisone by the free cortisol and free cortisone total. That is how we understand whether it is a fast cortisol clearance or a slow cortisol clearance. So why that is relevant? Because a fast cortisol clearance is seen in obesity, high insulin or insulin resistance, hypothyroidism, fatty liver disease. And a slow cortisol clearance is seen in hypothyroidism, severe anorexia, cholestasis, or liver cirrhosis. So that gives us a really good insight into possible diagnoses or conditions that we might assume our patients could be presenting with. So that is the cortisol clearance, as I mentioned, a newer addition to the report. That cortisol clearance is also included in the adrenal hormones and metabolites page. So this adrenal page now shows a cortisol metabolism box, which was not included in the previous reports. That just includes the metabolized cortisol, the systemic preference slider, so whether it is a more cortisone or cortisol preference, and then, as I mentioned, the cortisol clearance slider, which I just elaborated on in the previous slide. Okay, going onto the organic acids. The organic acids page has no changes. The only change to this specific page is obviously the format of it. So you'll see the format of the reports just looks slightly different, a little bit neater and cleaner, but the content and the information is exactly the same as you would have known from the previous report. All right, and then lastly, the final changes to the newer report are changes to the clinical support overview. So the original clinical support overview was really born of a need to explain why urine is uniquely useful for assessing hormones and metabolism. And the logical result of that was to add a lot of information to the back of the report, ensuring everyone who ordered a test had this resource in hand. So the negative impact on that is that it had very lengthy explanations and became a major barrier to many providers. And then over the years, due to the fact that the Dutch educational resources have grown immensely, and these resources far outreach the scope of the clinical support review, because they have grown and the research has grown, the clinical support overview has been refined in the back of the report and focuses very specifically on the patient's results, relevant medication, and lab comments. So that is a major upgrade to the support at the back of the report. Okay, and then just to end off, there are additional resources. On the Dutch page, there's a lovely article that goes into the details and the updates of the new report. So if you wanted any additional reading or further information, this is a good link to follow to provide that information for you. So those are the major updates